So lazy eye amblyopia is where one eye has a reduced capacity to see clearly compared to the other. And the two probably most common associations with that is a large difference in the prescription between the two eyes, or one eye that is turned. A turned eye a lot of the time can be sort of fairly obvious, and so that's a sort of a very quick marker. Amblyopia, though, if you've got a difference between the two eyes, with one eye having a much larger prescription, the kids are amazingly robust in their ability. They adapt to whatever they're kind of handed early on. So sometimes it may not actually be obvious, and it's through early regular sort of checkups that's sort of picked up. So you can get some signs where the kids might be persistently holding things close, getting close to the TV. You might see them persistently shut one eye in bright light and sunlight, or cover one eye, or do this kind of business when they're drawing and things like that. So there might be some obvious behavioural signs, but a lot of the time they can be just picked up through an examination. So being on that front foot, a bit like getting early dental checks and early medical checks done, early vision exams are part of that process of picking things up, because it won't be obvious.
And how is it treated? And is there like a critical age by which it should be addressed?
Look, I like to use the word sensitive age. So, primary school or before primary school is the number one. So, the earlier the better. Once you start getting into late primary, teenage years and onwards, it's not that it can't be treated, but it's a lot more difficult and requires a lot more effort. So the sort of the big hits are best done, before school, on being able to pick it up. One of both what we see clinically and in the research is that an appropriate prescription at the right time can do a lot about trying to manage amblyopia or lazy eye, and strabismus to a certain degree. It's not a 100% hit rate, but that's the number one leading therapy that you start with, is getting the eyes back into balance, and that's a really important one. And obviously parents have concerns about their kids needing glasses, and a lot of those concerns come from more age-related issues. But glasses become, in the right cases, a very important thing to consider managing those kind of cases.
And can amblyopia be fully corrected, or will children who have it always need some kind of vision support as they grow older?
That can vary from case to case. So there is certainly an age at which, once they leave that sensitive period, that if they're not being so compliant with wearing a prescription, that it's unlikely to go backward again. So good compliance early on is really important until they get into those sort of teenage years. That's a hard one to answer. There are certainly going to be some people who, once they start wearing glasses, that is their lot. Their vision did not develop in a typical fashion, and we just need to be able to manage that. And that's something we go through when we're talking to parents when it's discovered that their child's got amblyopia, of trying to give them some sort of long-term concept of, this may well be something that they need to be continuing to wear this for the rest of their lives. And in some cases, we might be able to back the prescription off a little bit, but it's very, very case-by-case basis.
So aside from glasses, are there other treatments that can be offered, like patching, or like, is it atropine eye drops? Are there any like other treatments that you
If
offer?
you look at probably two types of therapy. So you've got what they call penalization therapy, and then you've got binocular therapy. And so binocular therapy is probably the future and the more modern way of looking at things. The penalization is when you get into patching or blurring one eye, either optically or with the drop. And that's the one that's probably, it's been around for 100 years, that kind of concept. And it's a relatively simple treatment to do. Therefore, it's a very easy treatment to research as well. When you dig a bit deeper, though, it is a difficult one to get compliance with a lot of the time. So it does have its ups and downs in trying to manage it. So it's effective for a couple of lines of improvement. What they're looking at now is that it's very easy, when you have an eye that's not seeing well, to blame the eye being the problem, when actually it's really a processing issue on how the two pathways are interacting. And so that's where the newer therapies, looking at getting the two eyes to integrate and work together at a brain level, is looking really, really promising. because it's really a two-eyed problem. The way we like to talk about it is the dominant eye is telling the less dominant eye to back out of the relationship. And so we want to kind of work at getting that back together again. So they all have their place depending on age and how someone's presenting.